Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering urinary and renal disorders. This video is for the nurse practitioner student. Now, if you are a PN student, a VN student, an RN student, this will still be helpful to you. However, this video has been made specifically for the NP students. So if you are an NP student, you're currently in the program, you've graduated, you're studying for your boards for ANCC or AANP, this will be very helpful for you. Go ahead and forward this video or share this video, I should say, with any classmates that you have as well. Now, before we get started, as always, I'm going to ask you to please support me and support this channel. How can you do that? I'm so glad you asked. By liking this video, you're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you have done so already. And be sure to check out my website, nexusnursinginstitute.com. I have so many resources there available for you and so many great things coming down the pipeline. My current, oh, I got the green screen on, so you won't be able to see, but my current book, Nexus Nursing's NCLEX RN NGN cheat sheets is currently out for the RN student. Very soon, in about 5 weeks, the one for PNV students will be out. And then after that, the one for the nurse practitioner students will be out. I also have a test bank that I'm rolling out for all of you guys coming soon. I've got so many great things down the pipeline. So be sure to check out my website again, nexusnursinginstitute.com. And almost daily, you can find me covering a variety of nursing topics across my social media platforms, TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. All right, guys, without any further ado, let's get started. Renal disorders for the nurse practitioner student. Select all that applies. Okay, your patient has chronic kidney disease. Which do you expect to see on the lab report? Select all that applies. Hyperkalemia, hypokalemia, hypercalcemia, hypocalcemia, hypernatremia, hyponatremia. Your patient has chronic kidney disease. Which would you expect to see in their lab report? Select all that apply. You can only see part of the screen? Okay. Is that better? You're welcome. Your patient got CKD. What would you expect their labs to look like? Okay. Very good. You expect to see potassium up, calcium up, sodium up, something that's not on here that you need to know as well. Hyperphosphatemia, you expect to see that elevated in the blood as well. Think about it. Kidneys aren't working. So those electrolytes that we normally see released in the urine is not being released in the urine because the kidney's not filtering the way it's supposed to. So it's staying in the patient's bloodstream. Okay. One more thing you need to keep in mind is that this patient's going to have bicarb deficiency. Remember, which organ's responsible for bicarb? The kidneys. So we'd expect to see that patient in what? Metabolic acidosis. Very important for you guys to know. Okay. All right. Next question. Select all that apply. What are common causes of chronic kidney disease? Type 1 diabetes mellitus, type 2 diabetes mellitus, hypertension, hypotension, cardiac disease, obesity. What are common causes of chronic kidney disease? Select all that apply. You can't see the left side. There you go. Here are your options: type 1 diabetes, type 2 diabetes, hypertension, hypotension, cardiac disease, obesity. What are the common causes of CKD? And there are more. You need to know all of them. Okay. I'm happy that only 21 of you guys went with hypotension. So, common causes of chronic kidney disease, type 1 or type 2 diabetes. Diabetes, whether it's one or two, is a risk factor. High blood pressure, risk factor. Heart disease, atherosclerosis, risk factor. Obesity, risk factor. What are some other risk factors? Aging, being older than 60 years old, family history of chronic kidney disease, being Black or Latino. Those are all risk factors that you need to be aware of, okay? Okay, your patient has bilateral renal artery stenosis, excuse me. Which drug class would you never order for this type of patient? Aminoglycosides, alpha adrenergic antagonists, corticosteroids, and ARBs, angiotensin 2 receptor blockers. Again, your patient has bilateral renal artery stenosis. Which drug, under no circumstances, if you want to keep your license, are you going to order for this type of patient? Oh, you guys are all over the place on the live. Hmm. I had a feeling I was going to trick you guys with the aminoglycosides, and I did. The correct answer are the ARBs. Let me tell you something. First of all, if your patient has bilateral renal artery stenosis. So first of all, let's talk about what this is. So this is where the both of the renal arteries are narrowed. And usually it's narrowed due to arteriosclerosis, right? So this patient ends up having secondary hypertension. You're not going to give them an ACE or an ARB, either or. It's not going to be effective. And what you're going to end up doing is just causing that patient to go into acute kidney failure or have azotemia, which is, the buildup of all those toxins. You better not if you want to keep your license. And here's how I knew I was going to trick a lot of you guys with aminoglycosides, because you guys know the aminoglycosides, yes, they're very strong. They're very hard on the kidneys, but it's not contraindicated. They're hard on the kidneys, but if the patient needs them, then they need them, right? But under no circumstances, if a patient has bilateral renal artery stenosis, it's not contraindicated for aminoglycosides, but it's absolutely contraindicated for ACE and ARBs, both of them. By the way, as a nurse practitioner, let's say going off a subject, but this is another question boards, both ANCC and AANP, they love to ask, so you need to know this. Let's say your patient's a diabetic, they've got hypertension, and um, you need to give them something to help control the blood pressure that can also has protective effects of the kidneys, right? You're going to give them ACE or ARB. Guess what? It's or. You give them an ACE or an ARB. You never give these two together. You do that and you're losing your license. You're not going to pass your test. Well, I can't say you're not going to pass your test, but you're going to get that question wrong. Okay? It's one or the other. We never give ACE or ARBs together. All right, true or false? The most appropriate treatment for infective endocarditis is systemic steroids. Is this true or is this false? No, this is not. This is for nurse practitioner students who are studying to either take the ANCC or the AANP. Very good. False. So the question is, the most appropriate treatment for infective endocarditis is systemic corticosteroids. No, it's not. Think about it. Infective, duh, infection. Without hearing anything else, don't you think you'd be giving antibiotics? Of course. So infective endocarditis, this is infection of the inner layer of that the heart, that sac that holds the heart, right? The inner layer. Now, it's infective endocarditis. So, yes, there may be inflammation, but that inflammation is caused by what? Infection. So you want to treat the underlying cause. The most appropriate treatment is going to be systemic what? Antibiotics. Okay? True or false? The most appropriate treatment for vasculitis is systemic corticosteroids. Is that true or is that false? By the way, on that last slide, when we were talking about infective endocarditis, something else that you need to know for your boards, infective endocarditis is a risk factor for glomerulonephritis. You need to know that. Okay. So now to this slide. The most appropriate treatment for vasculitis is systemic corticosteroids. Is this true or is this false? Very good. It's true. Look at the disease process. Vasculitis, itis. If something ends in itis, what does that mean? Inflammation. What do we give for inflammation? Steroids. Hello. Something else you need to know. You see vasculitis? That also is a risk factor for glomerulonephritis. You need to know that for your boards. Don't say I didn't warn you. Next, select all that applies. What is the most appropriate treatment for Goodpasture syndrome? Plasmapheresis, immunomodulators, systemic antibiotics, systemic corticosteroids, opioids, anxiolytic agents. What is the most appropriate treatment for Goodpasture's syndrome? Select all that applies. Now, while you're thinking of your answer, let me explain to you what Goodpasture syndrome is. So, wait, by the way, whenever you see that word syndrome, don't be scared of that word. It's just a fancy word that just means cluster of signs and symptoms. That's all it means, okay? So, anyway, Goodpasture syndrome, this is a disorder where basically it's, by the way, it's an autoimmune disorder. You have to know that for testing purposes. The body's own immune system is attacking the kidneys. Okay. So in Goodpasture syndrome, the person's own immune system, their antibodies are attacking the kidneys. The most appropriate treatment is going to be plasmapheresis and immunomodulators. They work wonderfully together, and that's what you're going to order. You're going to order both immunomodulators and plasmapheresis for this patient. Why immunomodulators? It decreases the antibodies. I just told you that the problem is the person's own antibodies is attacking the kidneys, right? So it decreases those antibodies that are causing all the trouble, and the plasmapheresis gets rid of what? All those toxins. So remember those two. You need to remember plasmapheresis and immunomodulators when it comes to Goodpasture syndrome. What else do you need to know for your state exam? Oh, you need to know. So that's one thing you need to know, those two drugs. The second thing you need to know is that this is an autoimmune disorder. You absolutely must know that. Third thing you need to know, there are not too many questions on the state board exam for NP that asks, how do I word this? There are not too many questions where you have the disorders and it's unknown, but this is one of them. So this is the third thing. The true cause really is unknown. It's just generally agreed upon, and this is a common thought, but the true etiology is unknown. You need to know that. That's the third one. And there's one more thing you got to know about Goodpastures. I told you autoimmune, unknown, immunomodulators, and oh, I know the fourth thing. The fourth thing you have to know about Goodpasture syndrome is also that it is a risk factor for glomerulonephritis. Okay. So those three that I went over, you need to know. Infective endocarditis, vasculitis, and Goodpasture syndrome. Those three are risk factors for glomerulonephritis. Next question. Which would you most likely expect to see in a young, healthy woman with uncomplicated UTI? Would it be urinary frequency? Would it be fever? Would it be CVA pain? CVA, that's costovertebral angle pain, or lower GI symptoms. Which one would you expect to see in a young, healthy woman with uncomplicated UTI? Now, guys, I have really simplified this for you because I don't have enough characters in Kahoot to write the question the way you'd see on your exam. So I had to get to the point. But you guys need to know these concepts, okay? Thank you, Grace. Thank you, KT. Very good. Young, healthy, UTIs uncomplicated, urinary frequency, urinary urgency, dysuria. Those are the symptoms you'd expect to see. You would not expect to see generalized symptoms such as fever, such as costovertebral angle pain, such as lower GI symptoms. Those type of symptoms you would see in what? An upper urinary tract disorder, such as what? Pyelonephritis. Okay? How are you guys doing on the live? True or false? Your patient's PSA is normal. The rectal exam is normal, but they have an increased PVR and lower urinary tract symptoms. You order tamsulosin for this patient. Is this appropriate or inappropriate? Again, obviously, this is a male patient. Their PSA stands for prostate, what is the S? Prostate specific antigen. The PSA is normal. You did a rectal exam, that's normal, but the PVR is increased. That's pulse void residual, that's increased. Appropriate or inappropriate? It's appropriate. It absolutely is appropriate. So, guys, you should suspect that the patient has what? BPH. You're going to order tamsulosin. This is alpha blocker, and this is wonderful. It's going to provide immediate relief for this patient. Why am I thinking this patient has BPH and not something like prostate cancer? Look, I'm not giving you any biopsy results, anything. This is exactly what we're looking at, right? The PSA is what? Normal. And so is the rectal exam. But there is something going on because when I look at the PVR, the post void residual, it's increased. What do you think is causing that increase? Most likely it is that prostate that's basically choking the neck of that bladder, right? So the what you'd expect to order first is going to be an alpha blocker for instant relief. It's going to go ahead and relax that smooth muscle of the prostate gland and go ahead and relax the neck of the bladder. PVR stands for post void residual. So after the patient urinates, they still have a lot of urine in the bladder. They're not able to get all of that urine out, and it's because of that prostate. Now, before I move on, let's say the PSA was increased, rectal exam abnormal, increased PVR, lower urinary tract symptoms. Guess what? You're punting that patient. You're punting them. That patient's going to urology. Okay. Okay, your patient has dementia and urge incontinence. Which is least likely to worsen his or her mental state? You guys know I cannot pronounce drugs for the life of me. Okay, oxybutynin, tolterodine, derifenacin, or sulfonacin succinate. Again, your patient's got dementia and urge incontinence. Out of all of these meds, which one is least likely to worsen his or her mental state? Vincent said, my furniture started floating after hearing all of these drugs. Wow, only four of you guys chose the right answer. Guys, you guys need to know this. So derifenacin, this is a newer anticholinergic agent. You guys know I teach about the anticholinergics all the time. Adverse reaction. Can't see, can't spit, can't pee, urinary retention. Can't spit, xerostomia, dry mouth. Can't see, can't spit, can't see, blurred vision, and can't urinary constipation, right? Adverse reactions. However, this drug, which is an anticholinergic, it's a newer one. It does not have a lot of those side effects that your traditional anticholinergics do, such as what? Confusion. Remember, we're dealing with an older adult. The older that you are, longer time you've been on earth, more medications you're going to be taking. So we're concerned about polypharmacy. They already have an underlying condition which changes their cognitive state. They've got dementia. So that's very important that this newer anticholinergic won't cause what? Confusion. Okay, it's our derifenacin. You need to know that drug. Last one. Moxifloxacin is known to increase the risk of nephrolithiasis. Is this true or is this false? Yep, this is the last one. I'm sorry. True or false? What is the drug class of this medication, guys? What's that drug class? It's false. It is not known to increase the risk for nephrolithiasis, but guess what? You are expected to know which drugs do increase the risk for nephrolithiasis. What is nephrolithiasis? We're talking about stones, kidney stones. That's what nephrolithiasis is. Okay. Moxifloxacin is a fluoroquinolone, and it is not known to increase the risk of kidney stones, nephrolithiasis. But you want to know what is? Sulfa drugs. Write this down if you don't know it. You got to know this for testing purposes, guys. I'm telling you, sulfa drugs, loop diuretics, and excessive intake of calcium. Because what happens is like when I say calcium, I mean like literally like the calcium supplements, taking too many of them, right? So what happens is the calciums they just clump up and they form stones, especially if you're not hydrating. So excessive intake of calcium supplements, vitamin D supplements, even vitamin C supplements. That along with not being hydrated, perfect storm for nephrolithiasis. All right, that was it. It was just 10 slides. Let's see how you guys did.